My name is Gregory, I'm a chiropractor. I'm the director of Chiropractor Bramhall. My background is a bachelor's degree in sports injuries and rehabilitation, and then I went on to a master's in chiropractic, coming out with a master's and a doctorate of chiropractic. I originally found the instruments when using Graston tools back in 2012. And then through my education I came into contact with the HawkGrips and I found they were much better. So I found HawkGrips to be much more efficient when treating certain conditions. Treatment response time is much better. The application of treatment's far quicker. I use the instruments for a range of different injuries and pathologies, contractures, thoracic outlet syndrome, upper and lower cross syndrome, plantar fasciitis, soft tissue sprains and strains, and a range of other injuries and pathologies. Patients find them really comfortable, much less pain than trigger point therapy or just general deep tissue massage. And as I previously said, the application time is much quicker, so if there is a slight discomfort, the treatment is over much faster. Patients also find the side effects of treatment is much reduced, whereas through deep tissue massage there's quite a dramatic inflammatory response. These don't create the side effects that deep tissue and trigger point therapy do create. So I see and use the tools on a range of different patients. One of the main groups of patients I do use the instruments on is sports people, and golf has been a prominent area. And one of obviously the most common injuries for a golfer is golfer's elbow. And with the tools, I've found 1, reduction in pain, 2, an improved function, and 3, an improved response in strength through the use of the tools. Another common condition that I find the instruments really effective with, HawkGrip, is tension type headaches. So the stress and the tension through the muscles around the neck, with the help of the instruments, we get a really effective response to these tension headaches. Change from Graston to HawkGrip due to the slippage of the Graston tool where I use the emollient. So the HawkGrip's got a much better grip, so the reduction in slippage is massive. Also, there seems to be a better range of edges on the HawkGrip, and these edges are really good in use of the treatment when you can change the angle, so the depth of treatment can be increased with the different beveled edge. So I would use the larger multi-curve for bigger areas such as the calf, Achilles, upper trapezius muscles. I would use a medium multi-curve for small areas, elbows, wrists, coming into the ankle. And the smallest multi-curve is really effective with thumbs, declivane syndrome, Achilles tendinopathies, and other small areas, fingers, digits, toes. Tongue depressors are a really specific tool for trigger points and smaller areas of adhesion. It's one of the most common ones I use. The boomerang again is a great tool for bigger areas, so quads, hamstrings, bigger bulky muscles. The scanner I would use as a general tool just to try and identify where the issues are stemming from, and that will bring out a nice redness depending on where the adhesions or scar tissues lie. And then we've got the 2 handlebars. The smaller and larger handlebars are obviously good for different areas again. This one's great for, again, calves, gastroc biceps, and then I'd use the large ones for the thigh muscles, the quads, the hamstrings, and again into the upper trapezius muscles as well.